Hi everyone and welcome back to my vlog. It is 9:30 a.m. here in New York and I am up. As you can see, I'm dressed. Had an awful night. Um, I've been dealing with a lot of chronic heart palpitations and chest pains. Cardiologist is very useless. The last time I was at my cardiologist, he stated that everything's fine. What I'm dealing with is uh, I'm sensitive to my heart rate, or it's anxiety. Anxiety. Another thing he said that he goes, well, looking at your file, your stress test came back fine. Everything looks good. And I'm thinking to myself now, that I think about when he said that is the fact that I've never had a stress test. I don't even know what a freaking stress test is. I actually had to look it up yesterday. I was looking it up to find out what the hell a stress test is, and I have never in my life had a stress test. So whose file was he looking at? Because I've never had a stress test. I mean, I can go through all of my testing on my chart and whatnot, and I've never had a stress test. I've had heart monitors, I've had an echocardiogram. I have never once had a stress test. So I don't know what this dude's talking about. Well, anyways, back to my night. And it always seems like the cell phone holder that moves wants to push me into these totes. So let's see if I can get this to move this way. Okay, come on over. Let's move it over this way. If not, I'm going to manually move. Okay, I'm manually moving it. All right, so I manually moved it. I should probably turn it off if I'm not like maneuvering anywhere, because this is just ridiculous that it keeps wanting to push me in a direction that I can't go any further. Not like it would know. Well, anyways, let's move this. So I want to sit down. I want to sit down. Ugh, my Lord. All right. So also, when I was at my cardiologist, my last appointment, I was talking about how the fact that I had gained 60 pounds. Okay. Gained 60 pounds. I used to weigh 135 pounds. Stress, depression, trauma that I dealt with in just a short time, because I can look back at not YouTube videos. I can look back at TikTok videos and I can see that I was a lot smaller. Was I a healthy size? Did I look healthy? Not really, because I was sick at the time. But I went through a lot of trauma between the late summer of 2022 up until just recently. Just recently. And that's over 2 years of trauma that I dealt with. So, what I did is, normally a person, when they're depressed or they're dealing with trauma, they don't eat. Okay. And that used to be me. That used to be me because I had an eating disorder back in 2009. And it's it scares me when I lose my appetite, because then I feel like I'm going to end up going back into that stage of uh, being bulimic and being anorexic. Well, this time around, I felt like eating my depression, eating my problems. So I overate. I binge eat. I was binge eating. And the thing is even though now I am not eating as much, because I don't have access to all these cooking things that I would need. all the time because it is a community kitchen, and I refuse to go down in that kitchen because it's really disgusting down there. They need to get it cleaned up. Um, I usually eat things that are simple. And because of us having the minimum amount of food, you eat what you can. And we don't have like the healthiest foods. And we can't afford the healthiest foods because it seems like healthy foods are expensive. It seems like healthy foods are expensive. So it seems like the weight is not going to go anywhere, no matter how low I'm going in calories, because I don't know what my calorie count is because, I'm just eating what I have available for me, which really sucks because I love my fruits. I love my vegetables, fresh, not out of a can. I love my fresh fruits and vegetables. I love eating healthy. Just unfortunately, right now in a situation we are in, and financially, we cannot do that. Well, anyways, back to my heart. So I've explained multiple times to my cardiologist, and I've explained multiple times to my doctors and ER doctors that I get this crushing pain along with the heart palpitations. And, like I've said before in the video that I did about stop blaming everything on anxiety, well, that's the thing that they want to blame anxiety on. They want to blame it that because I'm having heart palpitations, it's anxiety. And my thing is I'm not struggling with anxiety 24/7. I do have a break from my anxiety. Um, it's not a 24/7 thing. And there's nothing that's like triggering it. I understand when I get heart palpitations when I eat something wrong, like something with a lot of sodium in it, a lot of caffeine, um, MSG, uh, a lot of sugar. I understand when I'm eating things like that. And unfortunately, a lot of things we do have is high in sodium, so I have to be very careful on what I eat. Okay? It seems like they don't give a shit anymore. It seems like they don't give a shit anymore. It's like I tell everybody, it's like the pandemic um melted these doctors' brains. Because I've never really had a lot of problems with my doctors not listening to me uh, until we ended up in the pandemic. So I have been struggling with heart palpitations for a while now, with no answers whatsoever. All because all these tests came back, fine. My heart monitors came back fine, blah, blah, blah. Well, you're looking at shit, and excuse my language. I'm frustrated, and this is not a PG-13 vlog. It is a serious vlog. This is my life. That's why it's called This Is My Life. They are looking at things right then and there, how my heart is going right then and there. Like an EKG. When you go to the hospital, you get an EKG. They're only seeing what your heart rate is going right then and there. Okay? It's not, I gotta move this. All right. Oh, come on. All right. It's not showing you 100% what's going on. When you get a heart monitor put on, depending on how long you have it on, um, it's not showing 100% what's going on. And you can have a heart monitor on for like a week, and that's not going to give you an exact look at how somebody's heart's going because things can change with your heart rate. Okay. If a patient is complaining of any kind of chest pains, heart palpitations, rapid heart rate, whatever, it needs to be really thoroughly looked into, monitored for at least a month, okay, to actually get a legit answer, because you can't just go off of what you're seeing in an EKG or a heart monitor. The thing is that cardiologists, I don't know how they are trained in college, but I think that with them being trained with a textbook that is probably outdated, um, they really do not understand 100% what's going on with somebody's heart. Okay. There have been many people out there that they had just heart palpitations and whatnot. It's gotten shrugged off as anxiety, and boom, they end up having a heart attack. Are you going to say that a heart attack was anxiety? Yes, they do say that stress can be the leading cause of death, um, and stress can cause heart attacks. So, are they going to say that that heart attack was because of somebody's anxiety? No, it was because something was overlooked. Something was overlooked. My mom was 47 years old. We lost her 2003, heart attack. Whether my mom had heart problems or not, I'm not 100% sure. She was an overweight woman. I wouldn't call my mom fat. I would never have called my mom fat. She was a big woman. I would never call her fat. I would never call her fat to her face because I'd probably be picking my teeth up off on the floor. And my mom was overweight, and you would think the doctors would say, we need to do something about helping you lose this weight because it could be affecting your heart. My mom was very young when she had a heart attack. We should not have lost my mom at such a young age. And I'm not going to talk much about my mom. I'm not going to talk much about what happened to my mom in this video because it's something I want to talk about when I talk about both my parents being gone. Um, but I will say, that was a surprise to all of us. The mom had a heart attack. I don't know the whole story of what happened because I wasn't there, and my family don't tell me shit. My family does not tell me shit. I do know that I had moved out of the house a couple weeks before it happened, and I know that my father kind of blamed me for it because I wasn't there for my mom, and it was a whole mess. Not something I want to talk about right now because it's just not something I really want to talk about. But that just goes to show you that it can happen at any time. It doesn't matter how old you are, young or old. Um, like like people say, diseases and health problems, they don't discriminate. They're not gonna say, well, you're a young person, we're not gonna give it to you. We're not gonna make you have a heart attack because you're young. No, you have a heart attack at any age. And that's what scares me. That's what scares me. It actually terrifies me because of me having these weird heart palpitations that nobody can freaking explain. um, it scares me because heart disease does run in my family. All right, so let's continue on to myself. Um, the cardiologist has said that all my tests came back fine and that my heart is fine. Just kind of strange. How can it be fine? I'm having heart palpitations and chest pains all the time. Where are they coming from? All right, so heart palpitations. How can you get heart palpitations? How can you get a rapid heart rate if your heart's fine? Well, I'm going to explain this one to you. Heart palpitations or anything going on with your heart that is not um, related to an actual heart condition, like heart failure, problems with the arteries, stuff like that. It's not always 100% going on with your heart itself. Okay. I had to learn all this on my own because my doctors are useless. I had to do my own research. I had to look into this. And it took me a long time to be able to understand, most of it. Do I understand all of it? No, I don't, because if I did understand all of it, I would not be here, dealing with heart palpitations, dealing with the chest pains, trying to find things to distract myself. If you eat certain foods, like I've mentioned before, sodium, MSG, caffeine, sugar, whatever, you can um, cause these, what they call these gastro cardiac symptoms, which means you can give yourself heart palpitations from these types of foods or beverages. Another thing is a big one is gluten, and that's going to be something I might have to keep an eye on because I've had a gluten intolerance before, was able to eat gluten again, but now I seem to be having a problem with it. So I might have to take gluten out of my diet, which really sucks because a lot of our food that we have here has gluten in it. And the thing is gluten-free foods are expensive. They're not cheap. They don't taste that great either. So it's not always the heart itself that can give you heart palpitations. It could be other things that give heart palpitations. Um, if you lay on your left side, I learned that something about when you're laying on your left side. I don't know if I've explained this to you guys before. If you lay on your left side, the way your organs kind of drift down when you're laying down, it causes some pressure on you right here. And what that does is it can give you a rapid heart rate or heart palpitations. If you lay on your back for too long, um, the pressure points in your back can send a signal up to your heart, leading to heart palpitations. If you lay on your stomach, you're crushing your abdomen when you're laying on your stomach. What that does is it can send signals up to your heart, to your diaphragm underneath, and that can cause heart palpitations. Unfortunately, there are a lot of things out there that can lead to heart palpitations. It's not actually heart related. And that is the scary thing because you never know what is causing your heart palpitations. It scares me having these chest pains and these heart palpitations because of losing my mother at such a young age. And it's really 100% pathetic that a cardiologist can't listen to that. That I'm concerned about my heart because of my mother dying at such a young age. I'm 43. My mom was 47. That's only 4 years away from the age I am now. When I get to be 47, you're going to see me, if I'm still doing my YouTube blog, which I'm hoping I can still be doing this, you're going to see me be a total wreck because I'll be 47 and all I'm going to be thinking to myself is, I'm now the age my mother was when we lost her. So there's a lot of things that I got to do to try to figure out these heart palpitations on my own. And it sucks. It sucks that I have to be the one to do it because doctors that are paid thousands and millions out there cannot do their own damn job, that now patients have to do the legwork. We got to figure this shit out on ourselves. So I was placed on a beta blocker by my neurologist for head pain. And the thing is it's supposed to be helping with migraines, but it's a medication for your heart. So it was actually helping my heart palpitations. Well, I don't know what the heck happened, because somewhere down the line, it started to backfire on me. It started to give me heart palpitations. And that concerns me, because then I go in and Google search and it says something about, uh, being hypoglycemic, or you having low blood sugar. It can cause you to have heart palpitations if you take a beta blocker. You're not supposed to take it, blah, blah, blah. I'm like, how do I know? My doctors refuse to do any type of testing. It's like, I don't have anything to prick my finger and check it. I don't. I mean, I used to, but I don't. So I've been figuring that maybe I have to taper off of the beta blocker and find something else that can help me before I end up going completely insane dealing with this. Well, for the past couple days, the heart palpitations have been just awful, to the point I just want to cry. And I know it's getting annoying to my husband hearing me say, I'm in pain, I don't feel good. But that's when you need to comfort your wife and say, you know what, honey, it's going to be okay. I'm here for you, blah, blah, blah. But my husband, he doesn't understand. I'm not blaming him for anything. He just does not understand, because it's not something he's ever dealt with. You know, I'm probably the most screwed up person with mental health that he's ever met. Maybe, maybe not. He has told me he had some crazy exes. Well, last night, I was originally supposed to yesterday cut one of my doses in half, never did it. But last night it got to be the last straw. It was the middle of the night. My heart rate was just going. I could not get to sleep, could not get comfortable. I was just not feeling it at all. So I reached for my magnesium glycinate. No, I'm not being paid to show you that. I'm not getting any commission. I'm just showing you exactly what I was using. Where it said 200 milligrams, that's for the per serving, and that's 2 pills. I only take one. I stopped taking it like 3 days ago, because I was seeing if that was giving me issues, which I highly doubt it was, but it was just, trial and error. I took that last night, and it did help. It did help. Magnesium actually does help with your sleep. And the thing is when you're on a beta blocker, it does deplete your magnesium. It depletes other things as well. So here I am battling with these heart palpitations, and what it's doing is it's making my depression worse, because I seem to want to just stay in bed, which isn't helping me, because I'm laying on my back. That's putting pressure on me, and that's bringing on more heart palpitations. And unfortunately, where I live, I don't feel really safe to be wandering around, and I suffer with really bad agoraphobia. And that's something I want to talk about later, not right now, because this is getting to be quite long video, and I'm hoping I kept a lot of viewers on here to be watching it. But I will say this: when you do struggle with certain things wrong with you, like heart palpitations or anything else like that, it can cause depression, and depression does make symptoms worse, because you're starting to feel low, and thoughts go in your head, and it's just awful. I think the next videos I'm going to do with you guys is probably talk about my mental health, because I originally wanted to start this vlog as like a therapy thing for me, somewhere where I could talk about my problems and somebody can listen, because I will not go into counseling, because it's a waste of time, it's a waste of my money. I will talk about that. Because I do want to talk about past history with what's been going on with me because of my mental health. So I'm gonna let y'all go because I'm going to do something I'm not supposed to be doing, but I'm gonna do it anyways. That's gonna be making me some coffee. No, it does not have. It's not regular coffee. It is decaffeinated, which means there's less caffeine in it than regular coffee because you cannot get 100% of the caffeine out of a coffee bean. Okay, so everybody that thinks when they drink decaf or decaffeinated, there's no caffeine in it. Yes, there is caffeine still in it. Just the same as non alcoholic beers. There's still a little bit of alcohol in it. It's just not going to make you loopy, make you weird, make you mean for some people, make you hungover. It just means it's non alcoholic, which means there's just not enough alcohol in it to, say, trigger a breathalyzer or something. I don't know. I've never really drank a non alcoholic beer. I have some here, but I've never drank a non alcoholic beer. So I'll let y'all go. And I know this room is a mess behind me, but when you have depression, it's kind of hard to clean when you're stuck in bed not feeling right. So let y'all go. When I come back, I'm going to figure out what I'm going to talk to you guys about. So I will see you all shortly. Bye for now.